ears, and cheeks. Those areas are really hard to recreate with surgery. I know often doctors say they're going to reconstruct something, but in my experience, a reconstructed nose or cheek or eye or ear is never as good as the one you got from your parents and from God. And so for this man, he's going to try to keep himself together. And I think that's a great idea. Staying together, keep your body intact, avoiding radical surgery. I like that. And I like a word from our sponsor. So here's the man with the golden voice, and we'll be back to take your questions shortly. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. Good morning. Hope you're A-okay today. So, we're seeing all these people outside running, jogging. Are they doing it to look good, to feel good, or to avoid cancer? Well, there's a new study that was published this week that showed that participating in athletic activities for more than an hour a day reduces the risk of breast cancer, and this applies to women of any age, any weight, regardless of location, according to research that was presented in Glasgow. Compared with the least active women, those with the highest level of physical activity reduced their risk of breast cancer by 12%. Now, there was a meta-analysis of 37 studies published between 1987 and 2013, representing 4 million women. So it's a composite study, putting all those studies together. And these studies, it was said, and I quote, "These are all studies looking at the relationship between physical exercise and breast cancer risk that have been published to date, so we're confident that the results of our study are robust." The results varied by tumor type, but the overall message was encouraging. Women taking hormonal replacement, however, the protective effects of exercise was canceled out. I remember about 10 years ago, women were warned not to take hormonal supplements, especially postmenopausal, because there are risk of increasing cancers, and women in general have responded by cutting back or stopping completely hormones. Physical activity has been known to have a protective effect in other cancers and other diseases such as cardiovascular diseases. The mechanisms are unclear, the authors write, and this is a recent study, this is from this week. The results are independent of body mass, so the effect is due to things more than just weight control. The age is also immaterial. So breast cancer is one more now added to the list of diseases that can be decreased or prevented by physical activity, and it's hopeful that this will encourage cities and people to get involved, become active, and help prevent cancers. And obviously, if you've got a lump in your breast, come to us. We've seen many women like you in the last year. We can easily work you up. Again, we're going to talk later in the show about the controversies of mammography, but we know that if you've got a lump that's growing in your breast, you need attention. So your own exam of your own breast is a 4-star test, and it's an important test. So if you're having pain, lump, questions, bleeding from the nipple, please give us a call. You can call us during the week at 212-CHOICES, 212-CHOICES, because you have choices. And we will work with you and offer you all the options and listen to you because you're the president of the United States of your body. And we are the president of the United States of your body. You make the decision. We, the doctor, are just the advisor. So don't worry. Things are not going to get out of control. You are the president of the United States of your body. If you've got a lump in your breast, please give us a call. If you haven't had a mammogram in a long time, please give us a call. We will work with you to do the right thing. And that actually goes for anything, lumps in the body or pains or bleeding or concerns that you may have cancer. We have a cancer treatment center in Manhattan, and we want to help you. We want to diagnose what you may have, or if you have a cancer, to treat that in the best possible way according to your wishes. We had a new man come in, actually came in yesterday with a bladder cancer. He had blood in the urine. He had a superficial cancer, which progressed to an invasive cancer. Invasive means it invades the muscles of the bladder. Now, the bladder does a couple things. One, it stores urine, and then the bladder is a muscle that can contract and push the urine out. And elsewhere, his doctors wanted to remove surgically the bladder and the prostate, and you can imagine how that would alter his life. He would never urinate normally. His sex life would be pretty much destroyed. And he didn't want that. He wanted to preserve his bladder and his prostate and have treatment that has a high degree of success. And that's indeed what we offered him. And there's data over decades showing you don't have to have removal of the bladder in every case to have effective therapy. And there's many people who are successfully treated with non-invasive treatment. And the beauty of our treatment in the stereotactic frame is it's so well tolerated and focused, and we can hit the cancer. So if you have blood in the urine, that could be a warning sign. Give us a call. If you have known bladder cancer and want treatment options, give us a call. Even if you have metastatic bladder cancer, if the cancer was treated elsewhere and that treatment didn't work or treatment wasn't tolerated, give us a call, arrange to meet. That's the best way to know what's going on. The best way is to give us a call, 212-CHOICES during the week, or after the show. We can talk about all the options for your situation. Now, here's a man who came in with metastatic cancer. So he had prostate cancer, and we know that prostate cancer can often be successfully treated in the early stages. This man has stage 4 cancer. He was seen by doctors who are starting hormonal therapy, and he wants to try to avoid some of the side effects of hormonal therapy. We've treated his painful bone metastasis, which is areas where the cancer is spread to the bone. It got through the bloodstream, spread to the bone, and had pain, so that was successfully treated. Now he wishes to do something to prevent his breasts from growing. He doesn't want was called gynecomastia. Gynecomastia is in a man, a woman's size and shape breast, and that can happen from hormonal therapy. So in fact, multiple studies show that if we radiate the breast bud, we can stop that gynecomastia from most likely happening. He can look and feel more normal for the rest of his life, and that's what he wants to do. So if you're thinking about hormonal therapy, you want to avoid some of the side effects of hormonal therapy like gynecomastia, here we are. And in the same topic, there's a Swedish study that shows that there's lower prostate cancer mortality, there's less death from prostate cancer in areas where prostate cancer is more actively diagnosed. So it's an interesting study. It was just published in the Journal of the National Cancer Institute, and a doctor named Staten found that the rates of prostate cancer mortality, excess mortality in men with prostate cancer, and metastatic prostate cancer were lower in areas where there was more incidence. So the doctors are saying that if patients are more actively screened for prostate cancer, the death rate falls in correlation. And this was a national study. PSA testing was done in Sweden starting in 1990, in the United States in about 1989. There's a four-fold variation in the proportion of men undergoing PSA testing in different parts of Sweden. And there's a rapid increase in prostate cancer incidence after PSA testing was started, just like in the United States. When PSA was introduced in the United States, many men without symptoms were diagnosed and treated for prostate cancer. And now the studies show in those areas where men were actively screened that the death rate is lower. So there's extensive statistics that go into this, but they show that there was a reduction of about 19% in prostate cancer mortality, so reducing prostate cancer by 19%. And we know in the United States there's tens of thousands of men who die of prostate cancer. So this is an important study. Another study, last week we talked about a study that looked at watchful waiting versus treatment, and it showed that men who had treatment lived longer than those who had watchful waiting. Now, I know this is a lot of news for you because many men have been told, oh, you don't die of prostate cancer, you can just watch it, nothing bad will happen. Well, in fact, now there's several studies. One last week, which we presented, showing randomized study. Men were randomly allocated to treatment or no treatment, and the group that got treatment had better survival, less prostate cancer death, and actually less death from other causes as well. So there's good reason to treat prostate cancer. And obviously we'd like to show our data because we've compared our results to radical surgery and found them superior in every category. So there's not much in the way of downsides. You can avoid the radical, most likely keep your sex life and your urinary life, and most likely see that PSA go down, 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 and stay there, which is what men want. So, on that note, 2 studies about prostate cancer. We're going to take a short break, hear from our sponsor, take your calls. We're at the WABC studio. We're live. You can pinch us. We're so live. We're not pre-recorded. We're here live doing this show, trying to provide you with information for a better life, better health, better treatment if, God forbid, you have prostate or other cancers. Again, we're at 800-848-9222. 800-848-9222. And now here is the man.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery.